Good afternoon. My name is Kamlesh Kaur and I'm a public health educator with Stanislaus County Public Health. This is your COVID-19 update for Thursday, August 13th. Our dashboard will be reinstated once we have sorted through the CalReady data from the state system. As of this recording, we've had 11,592 positive cases of COVID-19. We have 137 non-ICU patients and 54 ICU patients in our hospitals. We have lost 182 members of our community as of yesterday evening. Our sincere condolences goes to those who have lost their loved ones. Each day as we report this data, we recognize that we're weaving through a range of emotions in our community. The added anger, frustration, grief, and stress associated with an influx of information is expected because we're all human. While some of us may be able to navigate through this, there's a segment of our population, whether they are adult or they are children, who may not be able to cope with everything that's happening. This can manifest itself in many ways, including mental health issues in forms of changes in eating patterns, sleeping, or concentrating, worsening of chronic health conditions, or mental health conditions. Many members of our community resort to different risky behaviors such as alcohol, opioid, and tobacco use to cope with these issues. Because it attacks the lungs, the coronavirus that causes COVID-19 can cause health issues for those who smoke tobacco or marijuana or those who vape. As we learn about who is more impacted by this disease, available data indicates smoking is most likely associated with negative progression and adverse outcomes of COVID-19. Although further research is warranted as the weight of this evidence increases, it's always best to not breathe chemicals of any kinds into your lungs regardless of COVID-19, which means walking towards living a smoke and vape-free life. We know that smoking and vaping has a negative impact on our lung health. It causes many respiratory issues, and it suppresses your immune system and your body's ability to fight any infections. While it is easier to resort to quick outlets such as substance and tobacco use to deal with stress, in the long run, it only adds to our mental and physical health issues. There are other healthier ways to cope with any odd situations that we may be in. I know we keep emphasizing self-care, but we can never put enough emphasis because that's the last thing we tend to do for ourselves. Going out for an exercise and preparing a healthy small meal, even once per day, is a good healthy start. Picking up different activities releases endorphin and gets some of the adrenaline out when the frustration builds up. Just getting out and moving can be helpful to ourselves. Ignoring our feelings doesn't make them go away. Just talk with somebody who you trust. Think constructively. We can't change this situation, but what we can do is adjust our way of thinking. Be compassionate with yourselves and others. Remind yourself that you're doing the best you can given the circumstances. Be mindful and try being in the moment. We put ourselves through a lot of unnecessary misery, projecting into the future or ruminating from the past. For now, just take life by day in a stride. Preventing the spread of virus shouldn't be a cause of additional stress in our life. Simple preventative measures can easily become our norm. While we're taking a walk, we can be mindful of other spaces and keep a safe distance of 6 feet. Wear a comfortable face covering if you're in a space where it's hard to maintain a physical distance. After each activity you participate in, please be sure to wash your hands for 20 seconds. Small everyday actions taken by all of us can not only contribute to our well-being, but also for those around us. We can all adjust in small ways to stop the spread. United we win stand. Our actions can save lives.